Welcome to Impactful Chats, episode 4. I'm Malin Martinez.
Hi, and I'm Seth Truger.
And today we're chatting with Dr. Garth Walker. He's an emergency medicine physician and he's also an impact partner. Welcome, Garth.
Hi, guys. How are you?
Good, thanks. Thanks for being with us. How about just start by telling us a little bit about yourself?
Sure. So, growing up in Chicago pretty much my whole life, resided in the Hyde Park area. I spent most of my time, most of my career focusing on social determinants of health. I did med school at University of Illinois. I was part of the urban medicine program for individuals interested in policy and service. Was very involved with SNMA. I continued that mission throughout residency, where I worked a lot with a lot of the organizations that I worked with in the past. One of them being Turning the Page, where I did AmeriCorps in DC. I know Seth has spent some time in DC as well. And we were able to partner with them throughout my residency and as well as other organizations. Currently, I do a lot of partnerships with Creating Real Economic Destiny, CRED, which is a violence intervention program, which uses jobs to help reduce violence in high-risk communities, and still help out with Turning the Page. And I am on the advisory board with Affirm, a nonprofit organization that advocates for research and best practices to help reduce gun violence.
Great. Well, we've seen you on the news a lot recently talking about racial disparities that we've been seeing with COVID-19 for Black and Latinx communities. Can you summarize for us what these disparities look like, especially in Illinois?
Sure. So with respect to Chicago's very hyper-segregated. So a lot of wealth and a lot of race fall along similar lines. And where you see the COVID pandemic hit most are just those communities that have traditionally have poor access to care, poor access to healthy foods, poor access to be able to adhere to some of the most traditional public health measures that we've been putting out, social isolation, physical isolation. So when you kind of culminate all those different types of social determinants of health variables, they present a perfect storm where a lot of the disease falls along racial lines as well as economic lines.
Yeah. And what do you think, you mentioned some of the things that sort of on a foundational scale are contributing to those disparities, but what do you think, are there any more sort of immediate contributors specific to the pandemic that made these disparities so sort of vast with the outcomes with COVID-19?
With respect to immediate, I think, when we think about kind of how the healthcare system has and kind of the relationship it's been with Black and brown communities, been a very difficult history, one that's already had health disparities at baseline. When you think about the different policies that have been at play and kind of driving wealth, and in a context where wealth is just so tied to your ability to get healthcare, your employment, what the pandemic has really just done is kind of tip the scale in terms of a huge insult in our face in terms of higher burden of mortality in Black and Latino communities. And with respect to immediate measures, what we can do, typically what we've been advocating for is direct testing, intentional policy making that is targeted towards vulnerable communities. So ensuring that healthcare systems that serve them have adequate PPE as well as ventilators to help address the amount of disparity that will be affected in those communities. So those are some of the immediate plans that could probably happen. Those are kind of putting a Band-Aid on things that already happened. In terms of primary and secondary prevention, probably ensuring that the education and thoughts of how to reduce exposure are being delivered to those communities.
Yeah, so how have you been involved? What kind of work have you been able to do around these issues during the COVID-19 epidemic?
So one of the major partners that I've been partnering with is creating real economic destiny. So traditionally what they do is they identify all the hot spots in terms of where gun violence is happening the most. And they put community leaders, community members that have gone through CRED training, as well as that have a good command of what are the issues affecting those communities to help stem gun violence. What we've been doing is a lot of trainings just like this, talking about why it's important that we make sure we talk to our community about COVID, what are some of the issues and how we can prepare high-risk individuals that are essential workers and constantly exposing themselves to the virus, what they can do, as well as being cognizant about who's in the household, who is high risk, those with hypertension, diabetes, and what to do with that and how we can be creative about reducing the exposure to those high-risk members.
Yeah, that's great. And this, now we have a whole new sort of public health issue on our hands. And the last weekend when all the protests were happening, I think was was the deadliest weekend we've had in Chicago in 2020. And I was just wondering about your thoughts on how you think the pandemic, and I know you've done a lot of research and know a lot about gun violence in Chicago. So I'm curious what you think about how the pandemic, gun violence, and the protests might all sort of collide in that community and make things worse for that community.
I think it's from like a deep personal, so it's a very difficult position to be in, right? What people are protesting makes absolute sense. It's hard to justify that protesting against police brutality is wrong, because to the communities throughout Chicago is just as important as physically isolating, because essentially the history suggests that saying nothing doesn't prove anything. So my recommendations, generally speaking from that standpoint, is to do the same thing that I do as an ER physician, thinking about people's lived experiences. What is the best way we can improve healthcare outcomes while still moving the needle on health equity and justice? So make sure to mask up, try to be isolated, try to think of alternatives to help move the needle towards it. Who are your stakeholders? Who are your allies that can help hold these people accountable? I think because it's exacerbating poverty, and the COVID is exacerbating poverty in terms of tipping us towards a recession and high unemployment, violence will be there. I think that's one of the consistent things. You look at violence anywhere throughout the world, you'll see when people don't have a lot of alternatives, they resort to what they think may be rational, and that's some communities that may be rational. So I expect, honestly, I don't really know where it's going to go. I think there will be gun violence, and we have to think about significantly about how we're going to prepare for that. But on the other end of the spectrum, and the positive end of the spectrum, it's brought light to a huge injustice, and we're seeing allies from all corners come out and support advocacy against police brutality, as well as equity and other avenues that have been in the dark for a while.
Yeah.
I don't know if I answered the question, but I went on a tangent here.
Yeah.
The tangent was what we needed. You hit the nail on the head.
Yep. I mean, these are unfortunately, incredibly complex, really entrenched issues that we're not going to be able to magically fix. But it sounds like you're doing great work. Really, really helping push on this stuff. Thank you so much for all the work you're doing, and thank you for joining us for Impactful Chats.
Thanks for having me.